All
So
right.
you are up. I don't know if any introduction is needed, Greg. We all know you. We love you and the work that you're doing. So we're looking forward to your presentation.
Let's see if I can do this.
Thank you.
I'm trying to make you.
Can you click on that?
Thank you, President Jan, and Leela. Thank you for that amazing song, and everyone for singing. That was super cool, and it's still unexpected. So wow, that really means a lot to me. Thank you.
You're welcome.
It actually is better that we get to do this virtually, because I get to virtually walk you all through what we're doing here at Interfaith Community Services at our Escondido headquarters. So I'm gonna say a little bit here, and then I'll put on my handy mask, and then we'll walk around, and we'll have a time for questions and answers, and yeah, time together. So pretty cool that we get to do this this way. Interfaith Community Services has been around 40 years now, and it was created here in this community by a lot of people who are a part of this club, were a part of this club previously, and we're serving people in their time of need with food, housing, employment, addiction treatment, mental health services, and you know, it turns out all those things are needed even more in a time like this. And so our staff and our volunteers are continuing to provide services on a daily basis. And this is an opportunity for us to be able to share a little bit of that with you. So a couple of highlights. The Haven House Shelter, which so many of you are familiar with, our 49-bed shelter here in Escondido, used to operate as a night shelter. It would close during the day, and people would go out whether they were looking for work or looking for housing. And of course, with the shelter-in-place guideline that we have now, that's not a safe reality. And so our Haven House Shelter, like just about everything else around here, has quickly evolved and changed. And we're now operating a 24/7 homeless shelter here. And I'm going to walk you through what that looks like. And we've also added additional housing. We are housing vulnerable, unsheltered populations next door to me in the Super 8 motel. We have 80 rooms there. We also have another 40 rooms over in Carlsbad for people who are over the age of 65 or have health conditions, should shelter in place, but they're unsheltered and they don't have a place to shelter in. We're providing that short-term help and also trying to connect people into housing longer term. Before I do the little walking tour, are there questions that you all have? Anything in particular that you want to ask me or we want to touch on?
Yes, Greg, Jay. We used to cook. How are you providing meals?
So the meals are all being provided still. The club is providing what we call in a pinch dinners. You're actually funding us to either cook the meals ourselves in our kitchen or to go out and bring in takeout food for the residents of Haven House. So those meals are still happening twice a month, thanks to our club.
And Greg, this is Ron Smith. Do you see a time soon where even us geezers can come rolling in and help do the cooking?
Yeah, we actually do have some volunteers who are coming in. They may be older than 65. We're not 100% sure.
Well, unfortunately for me, you would be, but we're anxious to get back in there and do hands-on, but we'll wait for the green light from you guys.
Thank you.
Hey, Greg.
Amen to that, Ron.
Greg,
Yes.
I got the email about the volunteer opportunities, and I think I will try to see if I can help out to the cook, because I think they were looking for somebody to help to cook.
Yes,
so I'm trying.
absolutely.
So I think I'm gonna make a call to go and see if I can volunteer. I'm over 65, but I think I'm gonna take all the precautions to make. Is that okay if you volunteer after 65? If you are 65?
We leave it up to individual volunteers to do what they think is best for them.
Perfect.
And we have been communicating pretty regularly via email. You all are probably at a computer now. So I'll call out that our Interfaith website right there has a special COVID-19 landing page. So if you go to interfaithservices.org, you can click on it or type in COVID-19.
Okay.
And everyone can see all the things that we are doing. We are feeding people more than ever. We're moving people off the streets. We're doing home deliveries to seniors. We're operating all of our residential programs. We are a mailing address for people without mailing address. People still can come here and get showers. We're doing job training for youth, veterans, civilians. We're doing everything with social distancing as best we can. And we're still operating our recuperative care program for people exiting hospitals. So all that's happening. And if you go on the website, you can see ways for people to help. We do have a need for volunteers working in the kitchen, and you can click on little volunteer today and see all the different ways to help out. And you can also do things off-site. We need sack lunches. So you can prepare sack lunches and bring them here that we provide every morning. We're also helping people with to be able to get their laundry done in some of the motels that they're in. So you can package up laundry pods. You can put together little food packages, lots of different things you can do. It's all on the website. All right, so before I take you out and give you the little walk, any other questions?
How much has the need increased during this crisis?
So we're feeding about twice as many people a day through our walk-in services. And so I'm going to walk us through our lobby now. It's a quieter time because it's the lunch hour, but this is a good opportunity to just show you kind of what things look like that are different. So this is our lobby. Normally, our lobby would be full of people. You can see that when we do bring people in, we've closed down most of the chairs to maintain social distancing. And everybody who comes in first is screened by our healthcare partners at Neighborhood Healthcare. So we're going to exit out here. It's going to get real bright and then adjust. All right, so this is the entrance that you normally see. We have our friends from Neighborhood Healthcare in the background. Hi there. So, hi there. Hey, Beverly. So everybody who comes now gets screened and asked the same questions that a lot of us are familiar with. Do you have a fever? Do you have a cough? How are you feeling? If they're not feeling well, we don't bring them in. We connect them with medical treatment. And if they need to, thanks to Neighborhood Healthcare, we can actually complete the COVID test right here on site. That yellow tent there is specifically for COVID testing. And again, that's all possible due to our partnership, our co-located health center with Neighborhood Healthcare. So every morning and afternoon, families can drive here on site or walk here on foot, and our staff will meet with them right here in our parking lot. And so again, it's the lunch hour now, so we're closed for about an hour. But what you can see is that we have set up a numbered parking lot system where cars are pulling in, they pull in, and then one of our staff members meets them at the car and finds out why they're here. And if they're here for food assistance, then our volunteers go ahead and fill that food order. If they've lost their job, a lot of people have lost their jobs and have never been out of work before, have never applied for unemployment insurance. So we're helping them apply for unemployment while they're here. The food pantry is full thanks to our volunteers. We had volunteers from North Coast Church here this morning, and they filled, we had about 60 families come for grocery assistance just this morning alone. So that was filled from food that was donated by the community. We also have a significant need for Ilona, for hygiene items. You can see the stuff that's really important: soap, shampoo, diapers, all majorly needed. We have our kitchen that our club is familiar with. They're serving up meals now. We're serving meals for both the residents of our Haven House shelter, as well as the residents of our drug and alcohol treatment program. For confidentiality reasons, I'm not going to go into the nutrition center, but those of you who have served here before know what that looks like. So, especially those of you who have been around before know that this is a very different look from how we normally operate. Rather than bringing people in and having a face-to-face conversation in our offices, we're having conversations outside of cars, and then connecting people to services in the safest way possible. Our Haven House shelter is behind me. It is open and operational, and I'm gonna point the camera down at the ground for confidentiality purposes, and then I'm gonna take us in to show you what it looks like, especially those of you who haven't seen it before. So I'm gonna point the camera at the ground for just a moment, again, for confidentiality purposes, and it'll come back in just a moment. All right. Hey. All right, so I'm lowering my voice because we're here in the Haven House shelter, and some people are getting some rest. Some people are, you can hear that we're an animal-friendly shelter when need be. A little dog going there. Just trying to see how I can get a place without showing anybody's face. So here we can see some of our bunks, and you see a lot more empty bunks than we normally have because we have reduced the density of the shelter to accommodate with social distancing. So just wanted to show you that it is open and operational, and I'm gonna head on out here. And hopefully this is helpful for you all while I do my best to give you a tour while also respecting the privacy and confidentiality of everybody. All right, so that's a little bit about what's going on in the shelter. Here at our Escondido headquarters, next to us is the Super 8 Motel. It's back that way. And as I mentioned, we actually have 80 rooms there at the Super 8 that we are putting individuals into who are older or have chronic health conditions and are homeless. That's happening now in partnership with the County of San Diego and the Regional Task Force on the Homeless. And we are utilizing that resource as a way to help people stay safe. And we're also working with them to use it as an opportunity to end their homelessness. We've had multiple groups come directly out of Palomar Hospital into that motel setting. So that's relieving pressure on the healthcare system. And then we've also had somebody already graduate out of that hotel into housing just in the last couple of weeks. We've been doing this about a month now. So that's going on next door. Over here, I'm going to carefully kind of pan to the rest of the building. We have a residential drug and alcohol treatment program where we have an on-site detox, an on-site residential treatment, a 90-day treatment program, and then we also connect to outpatient treatment services, sober living. All of that happens right here, and we are providing all of these services in an environment where there's a lot more demand. Mental health needs are greater, the food needs are greater, and the people who we're working with, a lot of them have never been here before. So hopefully that's helpful to get a little kind of quick virtual tour of just this one location of what you all are supporting and what this community does through Interfaith Community Services. And just remember that we also have our recuperative care center here in Escondido. We have about 80 apartments over on Astor Street for families, for seniors. I think I heard Jack was on the call. We have Raymond's Refuge there, housing specifically for seniors. There's a lot going on, a lot of good things that this community has supported and that our club has supported. So that's my world's quickest, I think less than 5-minute walking tour of what we're doing here. I will open it up for questions and comments and other input from the group.
Greg, if I wanted to drive by and drop a check off today and a bag of granola that got a veto from my grandson, but it's a good one. Could we just drive in and somebody could come to the car and we could drop it off, or how would we do that?
Absolutely, great question. Yeah, we're doing drive-up food delivery. We're doing also drive-up food donations. So yeah, you can come by. Our Washington gate is closed so that we can monitor foot traffic and limit anybody from coming onto the campus who hasn't been screened. If I had walked, I should have walked to the Quince exit, the Quince entrance, which is open, and you would see that we have somebody there at all times. And so when you pull in, I think that was Nick, when you pull in, we'll ask, hey, why are you welcome, what's going on? I'm here to drop off some granola and a check. We'll say, great. Pull into space 7, and then we'll radio in, and then we'll come and pick it up directly from your car. You don't even have to get out. We'll take it, get it to the food pantry, and then get you a receipt for your donation.
Michelle Sullivan wants to know, could someone ask, what is the current capacity and how much capacity was reduced by the distancing requirements?
So the Haven House shelter has a capacity during normal times of 49 beds. We currently have less than 20 in the shelter that I showed you. And that's so that we can maintain the 6 feet of distance. However, we do have 63 rooms occupied next door in the hotel. So our overall capacity has increased, and we've reduced the capacity in Haven House until it's safe to increase the density there again.
Greg, Jay, what kind of sack lunches do you need, or you take, and how many do you need for people to drop by?
Oh, that's a great question. Our go-to are peanut butter and jelly sandwiches because they don't need to be refrigerated. But frankly, people get tired of just having PB&J sandwiches. A lot of the people who we're providing meals to, their only reliable source of food. And so deli meats, sandwiches with some protein in them are great. You can keep them refrigerated, bring them in here. We'll keep them refrigerated. And anything you would put in a sack lunch, healthy snacks, fruit, water, all those things are needed.
Drop them by any special time or just in the morning? Is that the best?
Yeah. I'm going to show you what I can in the Nutrition Center for those of you who haven't seen it. And yes, donations can be dropped off Monday through Friday, 9 a.m. to 5 p.m. and we'll have somebody here to accept the donation. And then other times we're here, so you can probably drop them off as well. You just might not have somebody running out to meet you in your car. But Monday through Friday, 9 a.m. to 5 p.m.
How many lunches do you need for a day?
150 a day.
So maybe some of us Rotarians, maybe we can put together like one does 20, other one 20, and then we can get 150.
Rosa,
so
it sounds like a great project for you to take on.
Great idea, Rosa. Sounds good, Rosa.
Yeah, I can go and pick them up, and then we'll just put it in my car, and each at your house you can put it together. So we'll get it all together for one day.
I'm in our Nutrition Center now. I wanted to show you that we do laundry facilities, as many of you know, but just wanted to show it to you. And then we also have showers. So personal private showers are available. We still provide this service. We used to do a hot meal in the morning, as you know, and our cafeteria, which is this way, is full of people right now, so I'm not going to show it to you. But we used to have that in the morning for people to come in. We're doing that meal service to go with the sack lunches. so that we can maintain the social distancing. But people still can come in and take a shower. A small number of people can do their laundry. And this is an absolutely essential service as we think about the importance of cleanliness and hygiene amidst this coronavirus. So I wanted to show you that all of that is still going on.
Hey, Irv, take note.
We got you. We got
Can you
you.
hear me?
I can hear you.
As a person with the boots on the ground, how close are we to having the curve flattened?
Well, I don't think I'm the best person to be able to answer that from a community perspective, but I can certainly say that Interfaith Community Services and other providers too have made a lot of changes to our services to be able to continue to provide the most critical things like food and shelter. And we've mobilized our financial assistance if somebody's about to be evicted or they have a car repair that needs to be able to provide that remotely.
Radiator into the tank and then it gets sucked back.
And unfortunately, we're seeing the opposite of that curve being flattened. The curve of people coming to us for food assistance has doubled. The amount of people. The amount of people who have lost their jobs, who are in need of other types of assistance.
Andy, mute it.
You see steam coming out of the tailpipe.
I'm sorry, Greg. Roy, mute yourself, please.
There we go. I got him. I got it. I found him.
All right, I'm
So,
sorry.
That's fine. It's fine. So there, there are more people that need help than before, and that is unfortunately only continuing. The direct stimulus checks that people are receiving, they will begin to receive that today or tomorrow. Anyone who has filed their taxes and did so via direct deposit should be getting their direct payment from the government this week. Our volunteers and our staff here do tax returns for thousands of families every year free of charge. So we continue to provide that service and do that both remotely and in a safe way here in the office. That'll make a big difference. So I can't speak to how we're doing on flattening the curve for the overall virus, but I can tell you that we're seeing obviously high levels of need for our services. And thankfully, we've done a good job to be able to connect people who are symptomatic to the medical help that they need. So we have an isolation protocol set up. We have an isolation space here at this location. If somebody is symptomatic and they're one of our residents or in our treatment program, we get them into that space. And then we can connect them into isolation hotel rooms if that's needed. And again, we're really fortunate because we have neighborhood healthcare. There are medical professionals right here on site to be able to make those connections.
Thanks for all you're doing, Greg.
Yeah, that's terrific.
Thank you, Greg.
Hey, thank you all. Thank you all for your support. I mean, the Interfaith Community Services is this community's organization, and we're a lot of people of different faith. We're a lot of people of just passion, of just good business sense, and just strong accountability, understanding that we all have times of need, and if somebody's there when we don't have a support system to give us a hand up, it can be a real lifesaver. And I have the honor of stewarding this organization during this time. But it's nothing to do with me. It's to do with the people of this community that have been doing this for 40 years now, and will continue to do it with your support and with others, helping people in their time of need. So thank you all.
Thank you, Greg.
Thank you very much.
Great program.
Thank you very much.
Any other questions for Greg? Greg?
Yeah, do you have enough toilet paper?
No. We need it. We need it. Yeah.
Okay.
We're doing home deliveries.
Greg, this
home
is
deliveries
Ron.
for seniors.
Yeah, this is Ron Smith. You can't see the screen, right? You're just, oh, hi, Doug.
Hi, Doug.
But you can hear. Anyway, the rest of the folks can see this. This blue badge is going in the Rotary name badge box for you. If this isn't the best who am I that we've ever heard in our entire Rotary career, I don't know what is. Anyway, it's there for you as soon as you can get there, but I know you have higher priorities right now, and God bless you for it.
Oh my goodness, I can't see it. Thank you.
Greg.
5 years. 5 years, people. 5 years.
I know, that's probably the longest red badger we've had. But we're very proud that you now have your blue badge, and we all are so grateful for what you do for all of us in the community, because there but for the grace of God go we, any one of us.
That's right.
We have seen that in this crisis, and we are blessed, and we are blessed that you are the one leading this fabulous organization and providing services to the folks in our community who are so desperately in need. So thank you. And now that you have your blue badge, we'll see you back when we're all able to gather again.
Absolutely.
So
Absolutely. Thank you. It means a lot to me.
Yeah, then we can